guys, it's Dr. Denney over at Four Paws, and today we're going to talk about a little bit of a tougher, sadder topic. I know there might be a lot of questions about, well, what if I think it's time for my pet to be euthanized? What if it's time to let my dog or cat cross the rainbow bridge? So this is going to be a little bit of that talk. It may vary a little bit when you're in the room with me if we're having a consult about quality of life, but this is kind of my talk about this, and I hope this helps answer questions, and I hope you know that we're here for you because it's a hard thing. Okay, so first off, what do we mean when we say quality of life? So quality of life means that my pet or your pet is still able to enjoy the majority of the things that they've enjoyed their whole lives. I always say pick 5 things that make your pet your pet. That can be, and you're gonna know these things. I typically, unless it's a dog that absolutely loves his or her food, I don't consider eating part of your quality of life. Eating is actually an instinctual drive. So I know dogs that were like almost on death's door that would still eat. So for me, unless your pet loves his or her food, I want you to take eating off this list, because I hear that a lot. Well, he's still eating. I'm like, well, he can't walk. And look at him, he looks sad. So if your dog is like a ball hound, like, oh my gosh, throw that ball, and I don't care, like, I'm gonna go wind, rain, snow. It's Texas, it's hot right now, so probably not snow right now, but you get the point. And what if we're older and we can't go get the ball, and we're on medications for arthritis, we're on joint supplements, we're doing all the things, and he just sits and stares at his ball? That's going to be one of those things. Okay, so you will know these things. I won't, unless you're one of my frequent flyers that's in for lots of things, and I know everything about you because I do have some patients and I know there are 5 things. But these are things that I want you to consider and talk with your family or your spouse or your partner or a friend, someone that knows your dog or cat very well. And let's talk about, well, are they still able to enjoy their lives? If you have an older pet that all they're doing is sleeping all day, they don't interact anymore, maybe they'll come cuddle a little bit, but it's, all they're doing is sleeping, that to me is not quality of life. Even for a cat that spends 80% of his day sleeping. My cat, the day that he doesn't come and greet me at the door, because he waits for me, he knows what time I get home every day, and he is at that window and I can see his little kitty face. That he does that. And I also know when he's not feeling well because he's not there. He also sleeps with me. He is up in my face at 6:30 in the morning, and if I don't come get him his food, I get cat chats. He talks to me, and my cat loves his food. And so these are some of the things that I recognize about my own animals. This is, use these as examples. So if we come in for a quality of life discussion, these are the things we're going to talk about. We may also have major medical problems. We may be in kidney failure. We may have cancer. We may have uncontrolled diabetes. There may be a financial aspect to it, and maybe we have a curable disease, but we don't have the finances to treat it. That's a hard place to be in, and I can tell you that it's better for the pet not to suffer. And that's so hard. It's so hard that finances play a part, but they do, and we have to be realistic about it, and I'm here to help you make those decisions. I'm here to support you through those decisions. So let's get into a little more about the process and things like what euthanasia involves. So humane euthanasia is basically using an overdose of an anesthesia that is such a high dose that the pet's heart stops. What we do here is, once we've gone over aftercare, I like to do that first. I like to have everything out of the way, payment, everything. That way, when it's time, all we have to focus on is your pet. That's it. I don't want you thinking about money. I don't want you thinking about what you've got going on at home. I want all of our focus here, and I want you to feel that. So we go over, we have an appointment, and if we've made a decision to euthanize, then we go over some paperwork that gives us the legal right to go ahead and euthanize. We talk about aftercare, meaning ashes, cremation, home burial. We talk about paw prints, so there's things that will be spoken about. And there's different packages. Just like there is in human world, what kind of, I don't want to get morbid, but what kind of coffin, so we have those options in veterinary medicine as well, and I don't think it gets talked about enough. So I think that this is like a topic that people want to know about, but maybe feel awkward or scared or sad asking about. So I'm hoping that this helps somebody. So after we go through that and we get like all checked out, the finances are done, I usually will give the pet some a sedation injection. This usually makes the pet very relaxed. We place an IV catheter. With our older patients, and especially sick ones, the veins cannot be great, so an IV catheter means that we know we have IV access. So it makes sure nothing can go wrong when I'm injecting the medication. I know it's going to go exactly where it needs to go. And then we let you guys have time. And you have a little doorbell when you're here, and when you're ready for us to come in, you hit the little doorbell and me and a technician will come in. And there's a series of 2 injections that I give. So the first one I give is propofol. This is a full-on anesthesia, so this is before the euthanasia. I like my patients, and my own pets, honestly, I don't want them to feel anything. I want them to be just like we're going into surgery, where they tell you to count back from 99, and by 97 you're asleep and you're not aware. It's just like a nap. That's what our pets do. The propofol can sometimes make them stretch, look up, stick their tongues out, or yawn. That's normal. It also slows their breathing down. Once the pet is completely asleep and under anesthesia, that is when I will give the euthanasia, which is a pink solution. After we've given this, then I will listen with my stethoscope and confirm that the heart has stopped beating, and then we give you time if you need it, and we help you, we support you. And this can take minutes, it can take hours. As far as like when you're ready to leave, the process of euthanasia itself is relatively quick for most cases. In most cases, the pet is ready and they let go, and it can be very peaceful. We do offer outside euthanasia under the oak tree. It's a little hot out for that right now, but we do offer that. We also do in-home euthanasias for current clients and clients that we're deeply invested in. If we can't get to it on our schedule, then I refer out to there's some mobile euthanasia companies that will come out and do it in the home if that's something you prefer. We try with our schedule, but sometimes I can't make it work in time. And when you're ready to leave, you leave, and then we go ahead and take your pet back to treatment, and we do nose prints and paw prints for you. That's complimentary. We do that for everybody. And if you're getting ashes back, it usually takes about 7 to 10 business days. We call you when they come back, and you can come pick them up. So euthanasia is very hard. It's very personal. I can tell you that not every client stays, and that's okay. There is no right or wrong. I have some clients that say their goodbyes and we take them over the Rainbow Bridge, just us. I can tell you that I have some clients that leave after their pet's no longer aware and their pet's completely just on the propofol, and I have some clients that stay the whole time. We're not here to judge. We're here to help you through, probably one of the hardest things that you'll ever have to do. It is part of owning pets, but it is really hard. But I like to believe that they go to heaven. That's a personal belief. Doesn't mean that everyone believes that. I choose to. And I would say that I think humane euthanasia can be the biggest act of love, to say goodbye. And it's going to hurt the most. It is going to rip your heart out. It hurts. And no one wants to make that decision. But we are responsible for them. We're their families. We're their caretakers. It is our jobs to make sure that they don't suffer. So euthanasia can be the biggest gift of love and the last gift of love. And it hurts. So if you have extra questions about this, or if you think that your pet may be nearing time and you'd like to have a quality life discussion, you just need to call our office and make an appointment, and we'll sit down and we'll talk about it. So I hope this helped answer some questions. I hope this put some fears to rest if you had some. And like I said, if you have questions, just give us a call. Thanks, guys.